Hello, today we're going to be discussing the American healthcare system and in particular the Affordable Care Act, also known as the ACA. First, let's discuss healthcare in the United States in general. When most people think of good healthcare, the United States doesn't always come to mind. And while we've led great technological advances in medicine, our system falls behind many other nations when it comes to actually financing and providing care. It's also been called the least universal, most costly healthcare system in the industrialized world and referred to as a paradox of excess and deprivation. Sadly, for many Americans, these words are all too real. No healthcare system can be discussed without first discussing its relation to public health. There's many different models of health, but two important ones are public health model and the medical model. The public health model, not surprisingly, looks at the health of the public, the entire population, while the medical model looks more towards the individual. In general, the public health model looks to decrease disease in the population as a whole and not just the individual. It tends to believe that the individual does not necessarily create their own health problems, but that society has created them, only to be adopted by the individual. It stresses the importance of societal rather than individual prevention programs for things like chronic diseases. And in general, it tends to be a more cost-effective means for preventing disease. The medical model, on the other hand, looks to decrease disease in high-risk individuals. And while this is important, it may cause tunnel vision regarding causation and therefore prevention of a disease. And the medical model may not target the right individuals. Many different factors must be considered when it comes to the medical health of an individual, and the medical model may fail to see them. I believe, as do others, that a combination of both models will yield the best results. Getting back to the healthcare system in the United States, as mentioned previously, there's a lot of room for improvement, and it faces many challenges. One of the biggest challenges the healthcare system faces is the shortage of primary care physicians. The number of medical students entering specialty fields continues to grow, and the number going into primary care continues to decrease. This presents significant challenges of access to care. There's also a limited number of physicians who accept Medicaid. While Medicaid covers millions of people, it doesn't do much good if they can't find a physician who accepts Medicaid patients. Another area of concern is undocumented immigrants. They're not allowed to gain insurance coverage, so many go without vital medical care, which goes back to our public health model. If our communities aren't healthy, the nation as a whole suffers. Other challenges are due to the fact that our healthcare system is just too expensive. Affording coverage is a burden even for the middle class. The system is also very fragmented, tending to treat patients as a condition and not a whole person. The patients receive care from multiple physicians, specialists, hospitals, and many times without anyone to coordinate the care. And finally, another challenge is conflicts of interest among physicians. Many are stakeholders in outpatient facilities and surgery centers or imaging centers, and many have ties to pharmaceutical companies, and it becomes very hard to separate the patient's best interests from the physician's financial gain. So, what is the solution? President Obama offered the Affordable Care Act as a solution. The ACA was signed on March 23, 2010, and its aim was to reform the nation's healthcare system in 5 primary ways. To reach near universal coverage, change the current health insurance system by improving its quality, equity, and affordability, create a high quality and more efficient healthcare system, improve primary prevention and primary care, and improve the public's overall health. If fully implemented, it would ensure 94% of the population. And while it has been criticized for being socialized medicine, Rosenbaum points out that it is actually more like socialized insurance. The ACA is very complex and extensive, but at its core, it's working to assure improved access, affordability, system reform, and an increase in the quality of care delivered. First, by improving access. It seeks to do this by eliminating the pre-existing condition clauses, increasing dependent coverage to age 26, implementing an individual mandate, covering preventative care, and improving mental health coverage and expanding Medicaid. It aims to make health insurance more affordable by implementing fair premiums, tax credits, and prohibiting rate factors. Premiums can only vary so much due to family size, geography, age, and use of tobacco. Next is system reform. This is done through cost sharing reductions, small business tax credits, rate reviews, minimum medical loss ratios for insurers, and creating co-ops. Employers with fewer than 25 employees can qualify for large tax credits, and rate reviews mean that insurance companies wanting to increase premiums by more than 10% must get approval first. Medical loss ratios mean if an insurance company spends less than 80% of premiums on medical care, a portion of the premium that exceeded that limit must be returned. Finally, it strives to increase quality of care through no lifetime limits, providing essential health benefits, and controlling out-of-pocket maximums. The essential health benefits it requires are listed here, although it's important to note that the extent of coverage in many of these areas is determined by each state. These benefits include ambulatory services, emergency services, maternity and newborn care, mental health and substance abuse, prescription medications, laboratory services, preventive services, chronic disease management, and pediatric services. So what effect does the ACA have on how healthcare is delivered? The biggest effect it has is that it stresses preventative care, which means that hopefully more people will be seeing their physicians in their offices or their clinics for routine preventive care and will be able to avoid urgent care centers and emergency rooms more often. It also helps people gain access to care closer to where they live. The Innovation Center was created through the ACA, which helped to create accountable care organizations, or ACOs, and these were created to increase quality of care while decreasing costs through integrated and coordinated models of care and patient-centered medical homes, putting the emphasis on preventative care and trying to make care less fragmented by the patient being able to be treated in one place with someone responsible for the continuum of care. What are some of the strengths of the ACA? It made great strides in decreasing the number of uninsured Americans, dropping from 44 million in 2013 to 28 million by the end of 2016, and the largest group to attain coverage were Hispanics. The ACA also highlights the importance of preventative care, hoping to change the current direction of healthcare system that utilizes secondary and tertiary care way too often. It also creates patient-centered medical homes and ACOs, as mentioned previously, to help with defragmenting care. With all the positives, there are still plenty of challenges, though. 32 million people are still uninsured, and the Act did nothing for undocumented immigrants that are in desperate need of quality healthcare services. Initially, the ACA mandated Medicaid expansion in the states, but the Supreme Court ruled that it could only be voluntary and not mandated. So unfortunately, 17 states have not opted to expand Medicaid, which has left many people without coverage, especially low-income childless adults. Over 2 million people still fall into the coverage gap, which means they're too poor to qualify for tax credits but not eligible for Medicaid. Shortages of primary care physicians to see all the newly covered people is also a challenge, and in the states where Medicaid was expanded, there's a shortage of physicians who will accept it. The ACA has had a significant impact on public health. In a general sense, just by increasing the number of people who have health insurance, it'll create an impact on public health. As the health of each individual improves, this leads to better health in the community, which leads to better health as a nation. More specifically, the ACA works to encourage employers to create incentives for employees who achieve wellness goals and improve their health. It requires insurance plans to cover vaccinations and other preventive services considered important by the U.S. Preventive Services Task Force, the Advisory Committee on Immunization Practices, and the Health Resources and Services Administration. And it calls for research to be conducted to analyze disparities in the healthcare system and to work to reduce them. It expands community healthcare centers and clinics and created the Prevention and Public Health Trust Fund to ensure monies are spent on prevention programs. We've talked a lot about the United States healthcare system, but how does it compare to other countries? So let's spend a few minutes discussing the healthcare system in France. The World Health Organization classified France's healthcare system as one of the best systems in the world. While admittedly there are imperfections in the system, overall individual satisfaction is pretty high, with high patient success rates and low mortality rates. It's based on the Beveridge model and was reformed over time. It provides universal health care, however, there's also a mix of public and private providers. While the statutory health insurance is mandatory for all citizens, supplemental or voluntary insurance is available to cover what the SHI doesn't. There's approximately 4 million people that do not have supplemental insurance. The system is funded mostly by employer payroll taxes, state subsidies, and taxes on tobacco, alcohol, and pharmaceutical companies. The universal coverage is for all citizens and undocumented immigrants if they have filed their residency paperwork, and it covers non-European visitors for emergency care only. In general, it includes comprehensive care, except for limited dental, vision, long-term care, and mental health services. And procedures and medications that are covered are decided at the national level, and the rates are set by the health ministry. The most out-of-pocket expenses a person incurs are usually from dental and vision services. And the low-income population, which is estimated at about 10% of the population, receive free supplemental insurance. There are some non-reimbursable costs, but they're extremely low, just over $1 for doctor visits, less than $1 for medications, and only $20 to $25 per day for hospital stays. And while patients can see a specialist without a referral, there are financial incentives for adults who register with a general practitioner, who then becomes their gatekeeper. Once referred to a specialist by the primary care physician, patients are usually able to choose from a large list of specialists. France works to contain costs in many different ways, which seem to be working as they reduce the healthcare deficit by almost $10 billion from 2003 through 2015. They do this by regulating physician incomes, putting restrictions on the number of medical students allowed, reducing acute care hospital beds, and increasing the use of generic and over-the-counter medications. They're also working to improve quality in healthcare by creating medical homes, like the patient-centered medical homes the ACA is working to create here in the US. The Terrain Law of 2015 is working to fight drug addiction. And the quality assurance and risk management is monitored by the health ministry, and they have created provider networks and national plans. Provider networks are where medical professionals can discuss cases, protocols, best practices, and evidence-based research. And national plans have been created for guidance on how to treat many diseases. So for a quick comparison, in 2014, the US's total expenditures were 17.2% of the GDP compared to just 12% in France. The total healthcare spending per capita was $9,364 in the US compared to $4,620 in France. And total out-of-pocket per capita was over $1,000 in the US compared to just $300 in France. Deaths per 100,000 people that were amenable to healthcare were 112 in the US compared to just 61 in France. One of the best things about the French healthcare system is that as the severity of your diagnosis increases, your rated coverage does too, which tends to be the opposite in the United States. So what are the future directions of the ACA and the healthcare system as a whole, and what are some of the solutions to the challenges? First, we must address the shortage of primary care physicians. College needs to be more affordable, and we need to expand loan forgiveness programs. Foreign-born doctors or medical students could be sponsored to practice in the US if they agreed to be primary care providers. Subsidies could be offered to help physicians start primary care practices. And we also need to expose medical students and residents to primary care more often instead of just specialties. Second, we need to increase Medicaid reimbursements and possibly require physicians to accept a certain amount of Medicaid patients to ensure access to care. As far as the future of the ACA, well, that gets hard to predict. Each administration has their own views on it, and there's no doubt it will continue to be challenged politically. President Trump has decided to remove the individual mandate, and many are trying to repeal the ACA altogether. Many people did not like the mandate, but what they do not understand is that the mandates are required because the system cannot work if young, healthy people don't enroll to offset the cost of those who require more medical care. And it's hard to make people see that one day they will not be so young and healthy and will most likely use more than their fair share of the medical care. While I don't think the ACA is perfect, I think it's done great strides for the health of our nation and for public health. ACA or not, there's still many issues with our healthcare system. One of the biggest problems facing our healthcare industry is the high cost of prescription drugs. Without regulations put into place to stop this, pharmaceutical companies will continue to put profits over the lives of people. And while the ACA does a lot to push our healthcare system to one of prevention, there's still a lot of work to be done. I think the expansion of other healthcare providers, such as nurse practitioners and physician's assistants, is only just in the beginnings, and I see a future where they're much more involved in primary care. In the end, the United States has a long way to go before we will be the leader of healthcare or even close to it. We have to treat medical care as a right and not a privilege. We must return healthcare to what it once was, to help prevent people from getting sick and taking care of them when they do, no matter what their race, gender, age, or income. I found a great quote that says, "To rebuff Medicaid, the insurer of society's most underprivileged and vulnerable, is to reject our moral responsibility as physicians and to worsen the very disparities in healthcare we have been charged with eliminating." As Christians, I believe we're called to provide for those that can't provide for themselves. Proverbs 14:31 says, "Whoever oppresses the poor shows contempt for their maker, but whoever is kind to the needy honors God." Deuteronomy 15:11 says, "For there will never cease to be poor in the land. Therefore I command you, you shall open wide your hand to your brother, to the needy and to the poor in your land." While every government assistance program can be abused, that doesn't mean that it isn't serving a vital role for millions of people. And I hope the ACA will continue to stand because I think it has made great strides in helping millions of people.